We have high inflation levels. We are servicing all these debts. With this SHI bill, the government is proposing to cover the poor and also to subsidize the informal sector, at least partially. So far, Kenya has covered about 1 million poor households, but we know there are still at least another 3-4 million poor households. How does the government plan to finance the SHI bill and especially the poor? Where will this money come from, Dr. Mwai?
Thank you very much. At least from where I look at it as an economist, money is never enough. And, one thing that happens within an economy is that as different, as the economy grow and it generates more income, just the same way an individual become, more richer in terms of incomes as they grow, then they are able to shoulder bigger responsibilities in terms of financings. So now within our constrained fiscal space, the expectation is that we want to identify what we would call the real indigents, which ideally these are people who have a very low ability to pay. But we also have people with low ability to pay who can pay something. And that is why we want to identify these ones. And someone would ask, why then are we going through the contributory mechanism? Is because the tax-based systems are largely, inflationary if they were to target the masses for contributions. So you'd see that there is reservations towards, altering the market in terms of introducing other taxations or targeting, for this kind of purpose. But having said that, is that you have seen that despite the challenges we have had, is that this government has been able to increase the funding and allocate resources for the community health promoters who were not in the previous budget. And therefore, while we talk about the issue of fiscal space and availability, there is also an issue of prioritization on where the country wants to put its resources. And we believe that when you look at the return to investments for health, they are far much higher than many other investment areas that the countries have been putting in. So the desire of this government is to generally prioritize, the social health or health benefits, so to speak, because a health population is base for production. And therefore, it is with great priority that you have seen the current shifting of funding to prioritize the community health promotion level, which is the community service level of service delivery. And as we move towards the second tier, as well as the social insurance, which will require such a level of subsidization for those who cannot afford, expectation is that the government will prioritize these areas so that despite the challenges in the fiscal space, we'll still be able to cover for the 3.5 million households or so that require to be covered. And those who can pay, then they are able to contribute based on ability to pay, where those who, have less money, contribute less in terms of value, but proportionately, we should all be, contributing the same. Needless to mention to you, Anne, that the current system is regressive. And this is where you find that the current NHIF, if you are earning around 10,000, you will be contributing approximately 5% of your income. But in the same country, if you are earning $1 million, your contribution will be at 0.017%. So it's an issue of also bringing equity and leveling the ground so that those who can pay, those the government is supposed to subsidize. And then we have a package of care that we can all, be happy for as a country. Thank you.